COVID cases are on the rise at the moment. There's of course a lot of vigilance that is being maintained by health departments across the country, as well as doctors and nurses at hospitals at the moment. You can see visuals of patients who are being treated at the moment. The national capital in particular is also witnessing a steep spike in cases. Remember viewers, the case count has crossed the mark of 4,000. Yes, there are more than 4,000 active COVID cases in the country. Meanwhile, Delhi Health Minister Saurabh Bharadwaj has stated that the national capital's COVID positivity rate is around 1% and has stressed that people must take precautions instead of creating a state of panic. He has also reiterated that the new JN.1 subvariant of the Omicron strain is not life-threatening. Meanwhile, let's in fact listen in to what he has said.
कोविड का ये जो नया स्ट्रेन है ये ओमिक्रॉन का सब वेरिएंट है। अब देखिए, अब जो नए नए स्ट्रेन आ रहे हैं कोविड के, इसके दो एस्पेक्ट्स हैं। पहला, एक तो ये बहुत ज़्यादा खतरनाक नहीं है, मगर इसका मतलब ये नहीं है कि हम लापरवाह हो जाएं। अब सरकार ये बताना चाहती है लोगों को कि देखिए, आपको सावधानी रखनी है, मगर पैनिक मोड में नहीं जाना है कि कोविड फैल रहा है, लोग मर रहे हैं, ऐसा पैनिक नहीं है। आप सावधानी रखिए। केरल के अंदर, तमिलनाडु के अंदर, केरला के अंदर, कर्नाटका के अंदर पॉजिटिविटी रेट हाई है, मगर फिर भी ऐसी कोई बात हमें केंद्र ने नहीं कही कि इसके लिए हमें पैनिक बटन दबाना चाहिए। हम लोगों ने तैयारियां की हैं।
All right, there of course we've heard comments made by Saurabh Bharadwaj, but joining me on the broadcast is my colleague Brian Thomas. Brian, over to you for more details.
Delhi Health Minister Saurabh Bharadwaj said, that the national capital's COVID positivity rate is around just 1%, and stressed that, people should, instead of panicking, should follow more precautions during this very. And even he even said that the sequencing of sample testings for positivity of COVID has been also ramped up, and said that the report of genomic sequencing is awaited, and even talking about the very situation in the national that 400 tests are being conducted every day, and the positive rate is around 1%. And even he reiterated that the new JN.1 subvariant of the Omicron strain is noticeably threatening, and he even says that India has definitely recorded a single-day rise of 412 fresh COVID cases, while the active caseload has risen to 4,117, as said by the Union Health Ministry. But yes, he says rather than people panicking, we should be more, cautious and should follow all the precautionary measures. And the positivity is just 1%. So rather than panicking, he urged the people to just, stay vigilant and stay proactive in this.
All right, Brian, I'd like to thank you. And as you know, my colleague Brian has highlighted, the active case loads are at 4,093 at the moment. And also joining us on the broadcast is Dr. Ishwar Gilada, a health expert. Sir, good morning and thank you for joining us on NewsX. The Delhi Health Minister has of course stated that it is important that people take precautions instead of creating a state of panic, and has also stated that this new subvariant is not life-threatening. This is something that you have been reiterating on our broadcast over the last few days. What else would you like to tell our viewers as far as what they can do at home is concerned?
Thank you and good morning. As soon as J1.1 cases were diagnosed in India, it was contemplated that it is highly infectious. It could have a major surge in COVID cases, but both did not happen. To the sigh of relief is number one, there is no clustering. That means if one infection is there in a family or in a society, there are not many infections. That means it is not very much infectious. Number two, all the infections are mild. Not a single death has been noted in the J1.1 subvariant. And up till now only there are 69 cases. So for 1 month we are talking about J1.1. The cases are not increasing. So its presence in India is not dominant. Our current COVID cases are even previous subvariants. So in that scenario, it is not going to create any havoc. people should not panic. They can take precaution because if you take precaution by using mask, you will be preventing many other infections, pollutants, allergens, and you will be good enough during the winter. But beyond that, nothing is required. Just enjoy your new year, be with people, see that your senior people which are 60 plus population, uncontrolled comorbidities are protected. Beyond that, nothing is required. As far as COVID is concerned currently, there is no task left, so there is no need of even now task force. What is currently more prevalent is influenza type A, H3N2 and H1N1 and respiratory sensitive virus. They are more common than COVID. So actually the entire program should be flu-like syndrome program or flu-like illness program. This should not be only vertical COVID program. And this Omicron variant of COVID has given a major sigh of relief to India. For last 18 months, India opened up, economy opened up, all schools and colleges opened up, tourism opened up only after Omicron came. So Omicron should be thanked rather than blamed.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.